The most effective way to save the lives of Americans on the kidney wait list is to end the kidney shortage. The End Kidney Deaths Act will do exactly that by providing $10,000 per year for 5 years to Americans who donate a kidney to a stranger as part of a 10-year pilot program. Consider this. A Super Bowl stadium holds 70,000 people. Today, more than 90,000 Americans are waiting for a kidney, and about 10,000 die each year. In the words of transplant surgeon Dr. Robert Montgomery, in the United States, only 10% of the people with organ failure ever make it on the list, and once on the list, only about 30% of the people ever get an organ. If you do the math, we're actually transplanting only about 3% of the people who could benefit from a transplant every year. It's the most highly rationed thing we do in medicine. Despite decades of extraordinary dedication from physicians, transplant teams, and donors, the number of living kidney donors has remained largely unchanged for 25 years. The End Kidney Deaths Act builds on the strengths of our current system while addressing its most persistent challenge, the shortage of available kidneys. When the patient moves from dialysis to transplant, they gain years of life and better health. At the same time, taxpayers save money. Taxpayers spend 1% of all tax money on dialysis treatment. Dialysis costs taxpayers about $100,000 per patient per year, and a transplant saves taxpayers more than $500,000 over a lifetime. When patients return to work, the societal benefit can reach $1.5 million. Because of the kidney shortage, patients and their families often feel compelled to search publicly for a donor. Americans should not have to do that any more than they would for insulin or antibiotics. In every other area of medicine, we ensure that patients receive the care they need to survive and thrive. We can do the same for kidney patients. Today, lower income and rural Americans are much more likely to die while waiting for a transplant. Increasing access to living donation directly addresses that gap. Living kidney donation is safe and carefully managed. Donors are rigorously screened and tend to live longer than the general population. In fact, only about 2 out of every 100 people who express interest in donating ultimately qualify and complete the donation process. This process is time-consuming and challenging. Donating a kidney to a stranger is an extraordinary act of public service that saves a life. Living donor transplants last twice as long as those from deceased donors, giving patients far more years of healthy life. Public and physician support for compensating kidney donors is strong, with 8 surveys showing broad backing. With this bill, Congress has a clear opportunity to save lives and reduce costs at the same time. With the End Kidney Deaths Act, we will save 10,000 American lives and $4 billion in federal spending every single year. We will live in a country where no one dies while waiting for a kidney transplant.